Honestly, some of the frustration that comes in working with this population is not having access to good referral sources that know about the condition and know how to treat it. There are very specific ways to stabilize the immune system in this condition that don't involve really very heavy hitting type medications, but doctors are still afraid to prescribe them. So, an example for Mindy, she was diagnosed with having a high level of histamine in her body, which is an inflammatory chemical that's put out by the mast cell in the body. And it's very common with hypermobility spectrum disorders to have an overactive mast cell that's putting out too many of its mediators. It's inflaming too much. So she had a titer of way too high histamine, but her doctor was afraid to prescribe antihistamines, which is an over-the-counter medication, because he felt, I don't specialize in this, and I don't want to go there. And so it didn't seem like it made sense to me that the doctor wouldn't prescribe an antihistamine for someone with high histamine levels that was obviously having a rash and inflamed and sensitive to histamine. So it's very frustrating when a doctor won't treat because the patient doesn't fit neatly into a box that they've been told that they need a patient to fit into. And that's a challenge with this condition, is that every patient's different. One patient might make a lot of histamine, another patient might make a different mast cell mediator too much. And so the same medication doesn't work the same on every patient. So it's very hard to get double-blind controlled studies that say that everybody is going to respond with this condition with this medication. We actually have to do a little bit of trial and error with these patients and find the regimen that's going to work for them. This is also a very sensitive patient population. So some patients are going to actually react to the medication that helps them because there's something in the medication, like an excipient, that they're sensitive to. So they might actually feel worse on a med that should help. So then the doctor's got to be creative and find a med that doesn't have that specific excipient in it in order to find the benefit for the patient. And I can't prescribe medication, so I can't help in that way. I really have to rely on finding good referral sources that can help the patient with that part of the puzzle, a piece of the puzzle. So that is definitely a frustration as a physical therapy provider, because I know how much better they can be if we can just help them with some of these mast cell issues. So oftentimes the patient has to advocate for themselves. There is not a lot of knowledge about this condition in the medical field, and I feel for the doctors because information is exploding right now, and it's impossible to keep up with all the different research on all the different areas of the body. And what's happening with Ehlers-Danlos alone is a huge amount of research is occurring right now to expand our knowledge, and it's impossible for one doctor to keep up on everything unless you specialize in this condition. And most doctors don't. There's no specialty for Ehlers-Danlos syndrome. It's connective tissue, and there isn't a specialist right now for that. I hope that there is one day. I think the change that's needed is to actually come up with a specialty in connective tissue. It's a tissue of the body that previously in anatomy dissection was just in the way of what we were trying to look at. We were looking at organs and muscles and joints, and we couldn't see them because the connective tissue was in the way. But turns out the connective tissue has its own function, and it really relates to the immune system and the autonomic nervous system. And we need a doctor or a set of doctors that are specialized in connective tissue function, and when it's malfunctioning, how to treat it effectively.